Today's topic is phenyl ketonuria, that is PKU. It is the most common amino acid metabolic disorder. Its incidence is 1 in 10,000 births. There is deficiency of hepatic enzyme, that is phenylalanine hydroxylase. It is autosomal recessive condition. There is variant of PKU also, which is due to the defect in dihydrobiopterin reductase enzyme. In PKU, there are alternative pathways. This phenylalanine, which is increased due to deficiency of the enzyme, and this phenylalanine is not converted into tyrosine. So there are alternative pathways like there is production of phenyl pyruvate, phenyl acetate, phenyl lactate, and phenyl acetyl glutamine. Phenyl acetate gives mousy smell. Phenyl pyruvate is a keto acid. It is excreted in high amounts. Now the chemical or biochemical or clinical manifestations of PKU. Number one, there is mental retardation, failure to thrive, failure to walk, talk, failure of growth, seizures, and tremor. There is low IQ of babies. Biochemical basis of mental retardation is not well understood till now, but there are some explanations. These explanations are under number one, it is supposed that there is impairment of transport and metabolism of other aromatic amino acids like tryptophan and tyrosine, which are necessary for formation of neurotransmitters like dopamine, norepinephrine, epinephrine, serotonin. If these neurotransmitters are less in brain, there can be mental retardation. Number two, second explanation is that synthesis of serotonin, which is excitatory neurotransmitter, it is insufficient from tryptophan. There is also myelin formation defect. Now, impact of PKU on pigmentation. Accumulation of phenylalanine inhibits enzyme tyrosinase and impairs melanin formation, causing hypopigmentation that causes light skin, fair hair, and blue eyes. Now, the diagnosis of this condition PKU, we can screen babies for increased plasma levels of phenylalanine by Guthrie test, which is a bacterial bioassay. Bacillus subtilis is applied. Normal level of PKU, normal level of this phenylalanine is 1 to 2 mg per deciliter, but in PKU patient, it is increased 20 times to 65 times. That is 20 to 65 mg per deciliter, very high. Now, phenyl pyruvate in urine is detected by ferric chloride test. Prenatal diagnosis is possible by culturing amniotic cells. Now, the treatment of PKU, how to treat this patient? Number one, we can do what we do, we can restrict protein diet to the patient, or we can take food which is low in phenylalanine. And the treatment for this baby, it needs up to 5 years necessarily, because the brain development goes up to, it completes up to 5 years, and restriction of protein diet for many years may be needed. We can do tyrosine supplementation also to this patient, sparing action. Now, if there is some serious patient, we can administer 5-hydroxytryptophan and dopa. If the patient is PKU variant, you can give tetrahydrobiopterin supplementation. Now, the very important point of this discussion is that what should be the diet of this patient? Diet should be protein deficient, or you can go for carbohydrate diet like biscuit, flour, bread, which is less in protein, pasta. Now, can we give fruits and vegetables to this patient? Yes, you can give, but in moderation, very less amount. You can use honey, butter, green tea, coffee, etc. But the only thing that should be kept in mind is restriction of protein diet to the patient. Thank you.